Good morning.
Morning. Good morning.
Hi.
Morning.
Morning. Let's see.
Good morning.
Good morning.
Morning.
Morning. Okay, guys. Any questions before I take off? No? Okay, so far everything is good. Okay, good. So let's just try to continue.
Professor, I just had a question. I saw on the Zoom links that it had a Zoom meeting for this Friday, but I know we don't have classes this Friday. So is
All
that
right,
just
that's fine. I'm just going to delete that. You don't worry about it.
okay? Thank you.
Okay, thanks. Anyways. I just like generate them as a recurrent, so I don't have to make an invite for each session. But I'm going to check that out. So anyway, thanks for the update here. Thanks.
You're welcome. Thank you.
No problem. Big news. News. Okay, guys. So now, although it's okay, a term not mentioned in your books, or at least not here, is history. Okay. Now, for instance, okay, if you put IA after it, that becomes a condition. Now, does anybody know what hysteria is? Have anybody ever heard of the term hysteria?
Yeah, it's when you're like hysteric. It's when you're over the top or exaggerated.
Or maybe a little decent way of saying nuts.
Yeah, there we go.
Okay, good. But okay, but if you look at the meaning of history, okay, guys, that may not have much to do with hysteria, but that's just the word for uterus. Okay, so I don't know how they link just hysteria to the uterus, but anyways, but that may say a little bit about yes, how things has been working. Okay, guys, a common term where we use the word hyster, which yes would mean the uterus is going to be ectomy. Okay, guys, now as I said, I think I mentioned that yesterday, ectomy is one single suffix. Okay, it is actually just a single suffix, but mainly as just we will refer to as removal. But even as if you look at the word ectomy as such, it is made up of two subterms, or yes, where one, the tomy, actually is or means yes, cutting into. Yeah, okay. Whereas the word ek mean is mean out. So ectomy actually is mean to cut out. Okay, cut out what? Yes, whatever your root word is. In this case here, the uterus. Okay, so hysterectomy, that is going to be yes, the removal of the uterus. Okay, so the next term. Otherwise, yes, they may use the word uterus as such. Okay, and then you can say it's uter. Okay, and we can say it's uterine. Okay, where here is the ine actually is will be is the pertaining to. Okay, so pertaining to the uterus is going to be uterine. Okay, so in some cases, you see it's they actually is may remove yes, some alphabets, meaning it's of a word, meaning it's to make it easier to make a new term by collecting. Most likely it's the suffix to it. Now another word, and just like uterus, as you can say, it's two terms related to it. We had hyster and we had uterus. Okay, so likewise is yes, the next word, which is going to be lapar. And it's if needed. It's we may it's combine it with a vowel, which in our case is going to be the O. Okay. Now what the word lapar means is the abdomen. Okay. Now in common terms, yes, we can call the abdomen or the lapar mean, yes, that would be what some people will call it, the belly. Okay. Now the distribution or the area is that is referred to as an abdomen. We will talk about that distribution in the next chapter. Okay, which area of the body is it that we call the abdomen? Well, pretty much as anything between your chest and hips. That area is going to be referred to as the abdomen. Okay. Now, when we say la part, let's do it this way. Okay, with a combining O, we may have yes, okay, mainly it's okay, just two terms that we can talk about. One is going to be it's okay, what we will call a laparotomy. Okay, the lapar mainly just meant is okay, we can say the abdomen. O was our yes, okay, combining vowel. And if you just look here, the word tomy, but we already mentioned it up here, means cutting into. Okay, so guys, if you look on your book on page, in my case, it's page number 12, figures 1.7. Okay, where you mainly yes, okay, see an abdomen. Okay, it's a belly button, or an umbilicus, as we may call it. And well, okay, in this case, it's okay, you have a, okay, yes, of course, it's stapled. Right, okay, but this is mainly as okay what they in common terms refer to as a laparotomy incision. Okay, did you guys get that? More specifically, as okay, if you go by this one here, so okay, this is going to be as okay a mid sagittal laparotomy. Okay, now why we call it a mid sagittal laparotomy? We can always just okay get to that, but generally as okay, just a big incision that was made by cutting into the abdomen, what we call a laparotomy incision or laparotomy. Okay. Just if you can say it's okay, then maybe it's okay. Another kind of okay is laparotomy. Probably smaller, like this, for instance, which we can say is okay, will be as okay a para umbilical. Laparotomy. Okay. Now, why do we call them para umbilical? Mainly because okay, what we see was that they are on the side or parallel to the umbilicus or the belly button. Did you guys get that? Okay, so now it may sound crazy, but there are yes, okay, some incisions that actually is okay may have names associated to them. Okay, back in the day, that's okay where they made okay yes big incision to yes okay you can say remove the gallbladder. Okay, that incision had a name associated to it. Okay, so that's something that okay may appear in the surgeon's notes. That okay, what approach was it that he or she used to yes okay access the area of operation. Okay, what kind? Okay, so yes okay, bigger or smaller yes okay incisions into the abdomen. Where you may yes okay just open up the abdomen or cut into it, or can be referred to as a laparotomy, unless and until yes okay a specific incision wasn't used. Okay, guys. Now, what they're doing nowadays is trying to be as okay, what we can say, mini invasive. Okay, just think of yes, okay, waking up after surgery with an incision like this. That's going to just okay, not only be painful, but also is going to have okay as a prolonged period of recovery, right? Okay, you can say, it's okay, there's a greater risk of, okay, as developing an infection and so on, so in this case here. It's also going to take a longer time to heal. And until that hasn't happened, yes, okay, the patient is still at, you can say, some sort of risk of developing complications. So what was it that they did then? Okay, they say, well, okay, is there a way by which we can, yes, okay, go from, okay, yes, big incisions like these to, yes, okay, something which is less invasive. And that's what you pretty much see, yes, okay, on the next, yes, okay, in the same slide, but figure number B, where we say, yes, okay, where we can say, yes, okay, we have that very same abdomen, which we say, yes, okay, we refer to as a lapar. Let's say, yes, okay, we make a belly button. Okay, but rather than, okay, yes, making a big incision, yes, okay, they may make, yes, okay, because yes, okay, 2, 3, yes, okay, small puncture holes. Okay, and through one of the holes, yes, okay, is going to be a scope. So they may do, yes, okay, they may use a laparoscope, mainly to do, yes, okay, what we in this case could call a laparoscopy. Did that make sense? So instead of, yes, okay, making, yes, okay, bigger or smaller, yes, okay, laparotomy incision, they will go, yes, okay, mainly, yes, okay, with the help of a scope, and okay, yes, through, yes, okay, these two smaller ports, yes, okay, that's mainly, yes, okay, where they may introduce the surgical instruments, the tips of them. Okay. And what is the scope here? Yes, okay, that means, yes, okay, there's going to be, yes, okay, a camera in it, and okay, yes, it is connected to a TV. So yes, okay, doing surgeries in this case is just like playing video games. You're looking up there while you're operating down here. Okay. And so, yes, that's mainly, yes, okay, how they do, that's okay, scopic surgeries. Okay. So you may hear or you may come across where they say, well, okay, done scopically. That may mean that, okay, they just make, okay, three, 4 small holes or puncture holes. Through one, yes, okay, a scope is going to be inserted. Okay, we then can be, yes, okay, rotated around all the points, okay, the area where the operationing is going on. But the rest is just going to be, as okay, ports for the instruments. Okay, so a common case is okay where they mainly is okay do scopic, they do it scopically more commonly do is that's okay to the help of a laparoscopy is gallbladder surgeries. 99% of them are done scopically nowadays. Okay, so yeah, so the patient have okay as a relatively as okay quicker recovery, which means you mean okay, yes, can walk home, yes, okay, I can move home, yes, okay, sooner. Okay, so yes, okay, for laparoscope, or yes, okay, laparoscope, laparoscopy. Scope is the tool, scopy is the procedure. Did you guys get that? Okay.
Yes.
Now you can pray, okay, they can pretty much, okay, do scopes of any type or scopies of any type wherever you have a cavity in the body or an area. Okay. So that's pretty much, okay, as the difference between those two. Okay. So laparotomy is, okay, was if we has, okay, made bigger or smaller incisions. Right, okay. Where, okay, as laparoscope or laparoscopy was mainly as, okay, where we did similar procedures is, okay, via scopes. Now, does anybody have any questions? Okay, guys. Now we can see, yes, okay, our next term is going to be Luke. And okay, yes, I think I already, yes, okay, mentioned that earlier, but okay, repetition doesn't hurt. So Luke is going to mean white. Okay, Luke is going to mean white. Okay, O is going to be, yes, okay, the combined vowel, yes, okay, if we need it. And okay, yes, to connect it with a suffix, for instance. So we can say, it's okay, we add something that we call a Luke O site. Okay, where we said that this here is, okay, was a cell. This was the white. And when we say leukocyte, that means, okay, going to be as, okay, the white blood cell or white blood cells. Okay. Now later on, guys, in when we're going to talk about blood, we will classify as, okay, the subtypes of leukocytes or white blood cells, because there are going to be five different subtypes of white blood cells, but they all together can be grouped as a common group known as the white blood cells, or also known as the leukocytes. Now, guy usually has, okay, two terms as, okay, related to leuk, or even as, okay, leukocytes, which people tend to confuse. One is going to be as, okay, what we call Luke O. Now here's, okay, the word site is being brought back. Okay, but as you see, it's okay, we just remove the E. And then we have another suffix, which is going to be osis. So leukocytosis. Okay. Again, we can still say that, okay, yes. Now here there should be no doubt that, okay, when we say Luke, is going to be the white. The site is going to be, yes, okay, the cells. Okay, and which white cells? Well, okay, of course, the white blood cells. Okay, now the word osis, the term osis, now since it ends with an assist, it's a process. But what the O here is, that, okay, this process is going to be as, okay, an abnormal process. Clear? Okay, so if you break it up in this way, as, okay, that will mainly mean as, okay, a state of this, okay, of your, of, as, okay, your white blood cells, which is not normal. Okay, but what leukocytosis actually means is that we have, okay, as an increased count of the white blood cells. Clear? Okay, and the question is how and why? Due to most likely as, okay, infection, or as, okay, inflammation. Okay, so it's not that abnormal after all. But what we mean is, okay, the thing that, okay, as we says, okay, makes it, okay, as abnormal from other days is that, okay, as you have an increased number of white blood cells. Okay, why? Mainly because, okay, in this instance here is, okay, your body is trying to, is, okay, fighting an infection, or is, okay, some sort of inflammation or inflammatory processes going on. Did you guys get that?
I have a quick question.
Yo.
Can you clarify how to, or when you can tell the difference between the O being a connecting vowel and it being part of the word? Because like cis by itself, right, we learned that as being processed, right?
Mhm.
So it could be easy in this case to say O is a connecting vowel and the O before cis is also a connecting.
No, O is not
So
in
can
this
you,
case. No, no, my dear. In
right,
this
right.
case,
I know in this case it's not. I'm just saying, like, can you clarify when you would be able to
you
tell?
have, okay. You can
I
make,
think I'm a
okay,
little confused on that one.
okay, because my dear, you have to look at the whole word. Okay, okay. But this, and that's why I say it's okay. And you will see as, okay, oses be as, okay, repeated again and again and again and again. Clear? Okay, okay. So that's just something that, okay, yes, may come with practice.
So if the O comes before the cis, it's abnormal.
In most instances, yes.
Okay.
Okay, so this oses as mainly as, okay, would end up meaning an abnormal process.
Okay.
Okay, but
And can you read that part in black? Sorry, one more time.
okay, so what is it that leukocytosis is? Okay, that's mainly going to be that you have an increased count of your white blood cells. Okay, why? Primarily because, okay, due to, yes, okay, you fighting an infection, or yes, okay, some sort of inflammation is going on.
Thank you.
Right? So how we can mainly, as, okay, just simply define what leukocytosis is going to be an increased number of white blood cells. Right, okay. Usually it's okay if you go to the doctor with a fever or something like that, and they give you some blood work. Okay, yes. One of the common things that they will be doing in 99% of the instances, well, okay, is do some blood counts. Okay, now that blood count come back with, okay, yes, a high number of white blood cells. That was, okay, your body is trying to fight something. Okay, they may even be able to, yes, okay, say what that something is based on, yes, okay, the type of white blood cell that is elevated. Okay, and so on. So, is it a virus? Is it a bacteria? Have your body already dealt with it, and now it's just, okay, just cleaning up after the mess? something like that. Right? Okay, that's all. That's something that they can actually get from the what we then call it, okay, a differential count, where they go and count as okay the individual types or subtypes of white blood cells. But generally, it's okay an elevated number or an elevated level of the white blood cells is broadly just called leukocytosis. Did you guys get that? Okay, so that's pretty much okay. What you just need to is okay. Look at. Okay, so here an elevated red white blood cell count is called leukocytosis, most commonly because of fighting an infection or as okay some sort of inflammation, etc., going on. Now, the other term that people may confuse with this. Do you guys mind if I go to another slide?
No, it's okay.
Good. Okay, thank you, dear. Is what we can say is okay. Luke, which again is okay is going to be as okay the white. Let's just say it's okay here is okay the white blood cells. Clear? Okay. We can say the next word is going to be M. E. Okay, so what does it end up as? What we call leukemia. Now, guys, just so you know, okay, let's get introduced to it. The word M here means blood. And whenever it's okay, a word ends with ia, that may mean that this whole term here is the name of a condition. So leukemia. Okay, you know, this is going to be a condition of the blood, pretty much okay as involving your white blood cells. Did you guys get that? Now, have anybody ever heard of the word leukemia? Okay. What have you heard about it?
It's common. Oh,
No, go, you go.
oh no, it's okay. So
You
I
can
was gonna say
toss.
yeah.
I got a count.
It's cancer.
Yeah. It's a cancer, right?
Yeah.
Okay. What kind of cancer? Pretty much okay. As we can say, roughly speaking, it falls under the umbrella term of blood cancer.
Yeah.
Clear? Okay. Now, so what's going to happen here is okay. Now, first of all, okay, what you will have is that there's going to be as okay, very high elevated white blood cell count. Is that clear? So you're going to have is okay, a very high count of white blood cells. But what these blood cells here are going to be cancers. Okay, so in cases, yes, okay, where we have white blood cell count, which is even beyond the normal limits of leukocytosis, that should raise a red flag. Okay, where they then mainly as okay, have to go in and okay, as check on the white blood cells. And what they will find is that some of those white blood cells will show indicate yes, okay, that they are not normal white blood cells, but actually cancerous. Okay. Now don't freak out. Don't get hysteric. But it's okay. One of the common features is that as a patient is mainly having recurrent fevers that doesn't settle. May get down for a couple of days or weeks or so and so, but then it comes back. And they try pretty much everything, and nothing really is may not even work. So yes, the fever settles, but then it's back in a couple of weeks. So yes, when we used to get patients with recurrent fevers like that, yes, we say now this needs to be further investigated. So yeah, but that's pretty much the difference between leukocytosis and leukemia. Both of them is generally involve your white blood cells. But this leukocytosis is not abnormal in a sense, mainly because it's your body's response to fight an infection. Where the leukemia is not abnormal, it's not normal. It's an very, 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 very high elevated count of white blood cells. And those cells are not normal, those are cancerous cells. And the thing about cancerous cells is, well, they're there, but they don't do the job. Not to make it, if that is not bad enough, well, yes, they actually also take all the energy or drain all the energy from the normal cells. So that's pretty much that's why cancer is bad. Yes, my dear.
I was gonna ask you, so like, do we all like as humans have like cancer cells in our body? They're just not
No.
cancerous?
No.
Oh.
They develop.
Oh.
Okay.
Doesn't cancer cells happen when like your white blood cells stop? What is that word that they go through? Like that they like, sorry, excuse my language, that they commit like suicide. When cells are dying, they like, what's the name?
Now, what mainly happens, what you mainly can say is is a common term for what we may say happens is mutations.
I thought they like fester if one fails to like delete itself, and then they start to fester. I remember learning about it in biology. Biology? I forgot, but sorry, that was irrelevant. I just
no, but generally it's what is it they may call this a cancer is the growth of cells that once triggers or once triggered continues. So that's roughly how they will define a cancer, and that's why you see the cancer mass just go bigger and bigger and bigger. So well, we can talk more about that when we get to malignancy and benign. What else can we see? So we had leukocytosis and we had leukemia. So please, guys, if it's too much, just remember leukemia is a very high count of cancerous white blood cells. Clear? Where leukocytosis, well, there's going to be an elevated count of your white blood cells. Most likely because your body is either fighting an infection, as some sort of inflammation or immune activity is going on. And as it says, okay, cancer cell doesn't do the job. And that may explain why they deploy more and more and more white cells are being produced, because the ones that you already have there are not doing the job. So the body's response, okay, it's not working out. Let me make some more white blood cells. So the level just goes higher and higher and higher. Or the body may signal, okay, I need some reinforcement here. Did that make any sense? Good. But guys, that's the difference between the two. Okay, that's the difference. That's the difference between the two. Okay. So yes, okay, leukemia, blood cancer of the white blood cells. And what you call her? Leukocytosis. What you want to call it? That's okay. Increased number of white blood cells primarily is okay due to fighting an infection or some sort of inflammation. Okay. But yes, okay, guys, we will come across yes, okay, the word EM, which okay, yes, or EM, which yes, okay, will mean blood, and ER, which will be condition. So if you put these two together, we can actually say it's okay that any term that ends with MER is going to be a blood condition. Or a condition is okay, which has something to do with the blood. Or is okay, involving is okay, the importance of the blood. Did that make sense?
Yes.
Good. Okay, guys. Now we can say the next word is never. And of course, just okay, if needed, combine with a what do you want to call it? Combined vowel, which is going to be O. And what never would mean is kidney. Now, please keep in mind, guys, there's going to be another word that also means kidney. And that is going to be okay. But we can just do it this way. That's going to be Ren. So the word Ren, as a root word, also means kidney. Did you guys get that?
Yes.
Now we can say, okay, let's do this. Never is kidney. O is going to be okay, in this case, a combined vowel between our root word here and the suffix that we may put, which is going to be, I guess it's okay, logic. So nephrology, that's going to be okay, the study of the kidney conditions and diseases and the treatments. Clear? Okay. And somebody says, okay, why didn't they use the word Ren? Well, okay, nephrology is just some more chick. Okay.
So nephrology is the study of kidneys.
kidney diseases.
Okay,
Okay.
thanks.
And that says, okay, God forbid, okay, as if somebody have kidney diseases, okay, they will need to see a nephrologist.
So logy always refers to like the specialty,
The
correct?
specialty
Or,
and largest will be the specialist.
right. Okay.
Just like cardiology, cardiologist, dermatology, dermatologist, and
Thank
so
you.
on. Yeah, okay. Now we can say another one. Nepher. Ectomy. Okay. Where the word nepher mean is okay, just meant kidney. And ectomy was what we can call is okay, the removal. So it's okay, when a kidney is removed, that is going to be called a nephrectomy. Or we can say the process of removing a kidney is called nephrectomy. Did you guys get that?
Yes.
Okay. Now we can just take another verb with the nepher. Okay, let's do it this way. No, sorry. Nepher. And here again, yes, okay, guys. This is going to be oosis, which we just earlier said is okay, becomes the name of an abnormal state or abnormal condition. Okay. Now there can be different types of that's okay, nephrosis. And okay, yes. One can be as okay, where we will refer to as hydronephrosis. Okay, now, okay. So here's okay, the word nephro is okay, is your kidney. And the word hydro. And basically it's okay, the word hydro meant water. Okay, but here we can mean it's okay, this is okay, fluid. Okay, so hydronephrosis, what is that? Okay, now what the hydronephrosis is going to lead to is going to be, it's okay, it will lead to, it's okay, what we call renal or REM. Sorry. Then we have O as a combining vowel, and okay, yes. Megali, yesterday said was. Mean is okay, that's the term for is okay. Enlargement of, in this case, that's okay, the kidney. Okay, but here is okay, the kidney gets enlarged. Why? Mainly because the kidney, mainly it's okay, swells up by accumulation of fluid in it. Now, what can cause that? Now, yes, Maria.
Oh, pregnancy. Yeah, I
Oh.
had it. Painful.
Okay. Now, was it the left or the right kidney?
I think it was my right kidney. I can't
Okay.
remember.
Mhm. Okay.
Yeah.
Although it's okay, it's usually the left. Now, that's a
It
$1
could have
million question. Why
It could
not
have been. It was so
in
long
case?
ago.
Okay, that's
Yeah.
fine, dear. It's $1 million question. Why the left? Why not the right? Or why not both? Okay. Um, okay, so it's okay. One reason could be pregnancy. But then is the question, okay, can men develop hydronephrosis? Good. So what could be
Yes.
another reason?
Is one drinking?
When you say drinking, what kind of
Like
drinking are you talking?
alcohol?
Nah, not necessarily, my dear.
Can you be born just like with an enlarged kidney?
That's going to be pretty rare, my dear. Like, first of all, that's okay. Okay. Um, there are some child-associated kidney tumors that you mainly as okay find in children primary. So you can say it's okay, maybe born with, or it's okay that develops in very early childhood. Um, but okay,
I think sorry, go ahead.
No, you go ahead.
I think in men it can be because of enlarged prostate, right?
you can put it yes if you just take that back. Now let us go with her example. An enlarged prostate, what would that lead to? Difficulty in
Blockage.
peeing, right?
Yeah.
Blockage in the
Okay. Now, when the person is okay has difficulty in peeing, what's going to happen? More and more urine is going to accumulate in the bladder. Now, the thing about the urinary system is that as things spread retrograde, or actually ascends up. So it's once the bladder is full and there's no way to empty it. Or it's going to be difficult for the person to pee due to this enlarged prostate. The fluid is going to ascend up through the ureters and start accumulate in the kidneys. But even things such as as kidney stones, ureter stones, strictures, anywhere is in the what we can call as the urinary tract can cause that as whatever fluid is being filtered out by the kidneys, which primarily as should have been peed out. But as if the door is blocked, or the exit port is blocked in one way or the other, what's that going to lead to? That as more and more fluid just accumulate in the kidney. And although it's the kidney is not like a balloon, but it's of course, it will swell up. Okay. So that's that enlargement of the kidney is if that is due to accumulation of fluid, then you will say it's hydronephrosis. But there could also be other reasons why that the kidney will enlarge. So the general term for an enlarged kidney is renomegaly. Did that make sense? So renomegaly is what you can call enlargement of the kidney. Hydronephrosis can be can mean why is it that the kidney enlarged? Pretty much due to accumulation of fluid. Did I make myself clear on that one? Okay. Now, you might not be born with an enlarged kidney, but you may grow in a way that your kidney just may end up getting enlarged. Giants. Do you guys know what a giant is? that they don't only exist in, yes, okay, fairy tale stories. Okay. So, yes, they will have larger kidneys than a normal person. Okay, and that's why, yes, okay, they don't live that long. Like, okay, a lot of giants, yes, okay, die in early ages. Mainly because, okay, those too large kidneys or any, that's okay, most of the organs, yes, okay, are going to be enlarged in them because of the bigger body size as well. Right? Which, yes, okay, unfortunately, yes, okay, may lead to, yes, okay, that those organs are more likely to, yes, okay, or is going to, yes, okay, easily fail. Which may mean, okay, once an organ fails, that's okay, it's not doing its job anymore. So you can say, okay, an increased workload. Okay, yes, okay. Oh, yes, okay. It has its tool on the body. So here we say it's okay. So hydronephrosis, that was mean, yes, okay, just the accumulation of fluid in the kidneys, and of course that's okay. I hope everybody will agree that that's not a normal phenomena. Yeah, okay. But what that will lead to is going to, yes, okay, what we can call is okay, renomegaly, which means that's what means, okay, the enlargement of this case is okay, the kidney. And the word megaly mainly is okay, or means okay, enlargement. Okay, enlargement of what? Just okay, whatever your root word is. Any questions?
Actually, I have a question.
Yes,
So
my dear.
the nephrosis and the renomegaly, they're both considered conditions, though, correct?
Yeah, states or conditions, yes.
Okay.
But in megaly, my dear, listen. And that's why I said, okay, what was it that the word megaly meant? Sorry.
Mhm.
Enlargement. Okay, now you can put any other word or any other structure here in front of megaly. And the word that you end up is just going to be, okay, enlargement of, yes, okay, whatever term you put here. Okay. So we had it yesterday, we said hepat o megaly. So how would that be? Enlargement of the liver. Did that make sense?
Hi, I have a little tip. Because the word Magali, I don't know if you guys have seen like that shark movie, like the Meg, but it's like a giant shark.
The word
So
mega would
yeah,
mean,
so
yeah,
that was like that's like a good way to remember it because I think of
exactly.
like the big shark.
Okay. Well, why would they call him or her mega? Because the word mega itself means big.
Big.
Yes, guys, please, if you can use cheats to remember things that is not forbidden. Okay, whether that cheat is from, okay, as the name of a movie or a scene of a movie or a chord of a movie, the lyric of a song, whatever, it doesn't matter. If it helps you, go ahead with it. Okay?
Thank you, Justine.
You're welcome.
Or you may say, it's okay. Now, not to promote any, it's okay, political slogan here, but it's okay, MAGA. Wait. Oh, okay. That's fine. But again, it's okay. You can just go and say it's okay. Any other thing can be McGalley, right? Okay, you can say Cardi or McGalley. That'll just be as okay, enlargement of the heart. You can go and say, oh, that's actually going to be as okay, an organ that we call the spleen or spleen. O McGalley, enlargement of the spleen. Now, guys, let's check this one here. Cephalomegaly, enlargement of the head. So have you seen people with extraordinarily large heads? Yeah. That's what you call it, okay, cephalomegaly. Okay, we can always talk about it, okay, the possible reasons for that. If somebody haven't seen, just look at George Lopez. Have you guys seen him? When you look at the size of his head compared to his body, it's not really proportionate, right? So now I don't know whether he is classified as a case of okay, cephalomegaly, or he just has okay as familiarly it's okay large head. But anyways, that will be it. Now, guys, those of you who are okay DMS, because okay, you will be doing okay kidney, so okay. There's another term okay where they use okay the word nephrosis, and we can just do this way and say okay. Nepher, sorry. And of course, okay, here also going to be okay roses. And you may hear okay that they use the word glomerulo. Okay, so glomerulonephrosis. Okay, now here's okay this, oh my guys, is going to be okay combining well as well. Okay. So what the blue this glomerulo is, that's okay. We will talk more about that when we get to the kidney. Okay. But it's mainly as okay a condition in which okay as this glomerulus, as we call it, is okay may get damaged in the kidneys and can lead to okay what there's a whole referred to as a glomerulonephrosis. Okay, but where you can say it's okay the damage of okay is this glomerulus in the kidneys is okay will lead to is okay what they call glomerulonephrosis. Okay. Now, a common complication of diabetes, or that's okay what people call sugar. Okay. So one of the common effects of diabetes upon the kidneys is going to be as okay glomerulonephrosis. Did you guys get that?
Is the word glue and glumero like related to glucose?
No.
Oh.
No. Here the glomerulo is mainly as okay just the name of a structure that we will find in the kidney, or more accurately as okay, which is going to be as okay a nephron. Okay, so that'll take me as okay to this one here. Let me just do it this way. Because okay, when we use the word, sorry. When we use the word nephron and we say kidney, but then there's going to be something that we will call as okay a nephron. Okay, so guys, this is going to be as okay what we can call as okay the basic filtering unit of kidney. So we mainly say as okay that there's approximately as okay 1 million nephrons per kidney. Okay, so it's okay that basic filtering station that you have in the kidney is going to be called a nephron. But each of your kidney has approximately like 1 million nephrons. Clear? Okay. Right. So usually it's okay when we take the word nepher, it means it's okay derived or it's okay linked to the nephron, which is that basic filtering station of the kidney. Where usually it's okay when we use the word REN for kidney, it's talking about the kidney as a whole, as an organ. Clear? So it's okay. A lot of things goes under two names, right? We had two names for the brain, right? What were the two terms that were related to brain? Anybody? What were the two terms related to brain?
Cerebral, oh, cerebral and cephal. So
It's cerebral and encephal, right? Okay. Cerebral and encephal. Good. Then we had two terms related to belly.
Is it gastro or gas?
No, my dear. Gastro is stomach.
Okay.
Is it Lapar?
Is
Lapar?
this
Lapar?
Lapar? Okay, Lapar. Okay, good. And I intentionally didn't use the other word, and I said the word belly.
Abdomen.
Abdomen. Right? Okay. Good. And likewise, kidney. Yes, okay. Two words, ran and never. As I usually say, it's okay. Usually, it's okay. We use the word ran when we talk of, when we talk refer to it's okay. When we talk about the kidney as a organ as a whole. Okay. And Never is pretty much okay, referring to yes, okay, you were. It's okay to the nephrons. Okay. And that pretty much okay brings us to yes, okay, another word, which is neural. And it's okay. If needed, it's okay, we may combine that with a combining vowel, which would be O. And the word nerve actually is okay, stands for nerve or nerves. Okay. That's why it's okay, we may have somebody who is going to be a neurologist. Is that clear?
Yes.
Okay. You may also have, yes, okay, somebody who is going to be, yes, okay, a neuro or surgeon. Did that make sense? Now, guys, just the changing of okay as one single letter with two or two letters by one may make a hell of a difference. Because okay, we have something that we call a neuron. Okay, when neuron is made as okay, that's going to be as okay the basic cell of a nerve. So this neuron here can also be as okay verb we can call it as okay a nerve cell. Okay, guys. Now, guys, when we talk neurologist, does anybody know what kind of conditions they deal with?
Brain disorders.
Now, when you say brain disorders, what kind of brain disorders?
I don't know specifically.
Schizophrenia? No?
Hope not.
No?
Parkinson's.
If neurologists were dealing with schizophrenia, I don't know what a psychiatrist would do.
Epilepsy?
Epilepsy, good.
Spinal or like spinal cord, no?
Spinal cord diseases, like okay, yes, okay.
And then
Parkinson's.
sorry.
Parkinson's, okay, pretty much okay as diseases involving or as okay affecting the organs of the nervous system, brain, spinal cord, and nerves. Migraines and things like that. Okay, pains, different kind of painful conditions. Okay. Yesterday, somebody yes, okay, mentioned multiple sclerosis. Okay, that would be a neurologist job. Parkinson's. What else? Okay.
MS.
Huh?
MS.
That's multiple sclerosis.
Oh, I didn't hear you say that.
Okay, that's okay. Yeah. Okay. Otherwise, things such as schizophrenia, psychosis, depression, OCD, eating disorders. will be as okay on the table of a psychiatrist. Yes, Susan.
So I just wanted to add something though. I know that they don't specialize in it, but people that do have like psychosis or problems in the brain, they do send to a neurologist to make sure that everything is functioning in the brain before
Yeah,
they kind of rule that out before saying you
Mhm.
have, depression or schizophrenia.
Yeah, I worked in the schizophrenia union at Connecticut Mental Health, and they saw neurologists regularly.
Okay,
Eh,
but yeah. Okay, that's just okay. You can say it's okay. A difference in algorithms, as they may put it. Uh, Back home, yes, okay. A person with schizophrenia will directly be brought into the psychiatrist. Okay, I don't think that. Okay, okay, calm it down and make it all okay. Yes, okay. Rule out some physical, neurological reason that might trigger. Yes, okay, his or her schizophrenia. Okay. Okay, so Jen, I guess you may have some interesting stories.
I do. I have a big
Okay.
background in mental health, so
No, no, with the schizophrenics.
yeah, yeah, plenty of insight on that.
Okay.
So
Now you.
why?
Okay, now I've been on a rotation in just like different, 3 different psychiatric departments, 3 months. So I'm, well, I won't say subspecialized, but okay, yes. So, but yes, you come across some interesting cases. They may be fun to hear about here, but not fun to be around. Let me just put it this way. So
Unsettling for sure.
yeah, so
Yeah.
okay, guys. Okay. So that's okay. A nerve disease is a disease of your nerves. Okay, our nervous system, which will include is okay, brain, spinal cord, and that's okay, your nerves in your body. Okay. There may be is okay another thing, and okay, we can say look, that will be is okay what we call neuropathy. Now, guys, here is okay. The word nerve actually is okay. Is just your nerves. O, since it's written in blue, is just the combining vowel. And what the word pathy is okay. Now here the Y mainly is okay indicate that this is going to be as okay because it's okay a name of a condition. But the word pat mainly is okay is a term for disease. Okay. So neuropathy. Right? Now, not a specific disease, but as well as okay, a broader phenomena of okay as disease developing in the nerves. Commonly seen in patients with diabetes. So one of the complications of uncontrolled diabetes is that they may end up develop what you call neuropathy. Okay, now how it usually goes is to begin with, yes, okay, the patient will have is okay, extreme pain, burning pain and sensation. Usually it's okay in the hands and the feet. But sooner or later, yes, okay, what happens is they lose the sensation. So yes, okay, their shoe sole may get perforated by okay as a 6-inch nail, making okay as a bigger or smaller wound in their foot and they won't know about it because they can't feel it. So that's a second idea. That's so that actually is okay something that we call as okay diabetic foot. Have anybody ever heard of that one? Okay. So because they may not know that okay they have developed okay as a big or smaller wound at the sole of the foot because they don't feel anything. It's okay. No news is good news. Okay. And then okay, the high blood sugar levels and all that, okay, yes, and that boom just becomes bigger and bigger and bigger, and it erodes and it goes to the bones, and then you have just okay, chop off the foot. It's okay, yeah.
Oh, hi. I was just asking,
Okay, hi.
hi. I was asking, does Ia and like IA and the like those both mean names of like conditions?
You can put it that way.
Okay.
Okay. Now, not necessarily because the Y can also is okay either be as okay condition or process or state.
Okay.
Okay. But when we see the word path, now that in technical, it's okay. In medicine is okay. The word path doesn't mean okay. I took the path. The word path will mean disease. Okay, so you're probably going to come across that as a rude word in just a little bit. Right, so the word path would mean disease. Or when you say it's okay, pathy, disease state. Okay, and then we say it's okay, neuropathy. Okay, so neuropathy is still as okay that it's still okay as a wide array of conditions which may not have as okay specifically as okay grouped or as okay individualized, but maybe that's okay. It's more of okay a big umbrella term. Okay, of okay as disease that is okay may involve the nerves. Okay. Okay, guys. Any questions?
Hi. Actually, I have a question. So, I'm reading the book here. So I was just wondering, what do you think the best way to study is? Like to make flashcards or write it down? Like, I'm not sure.
No, my dear. Okay. Well, you got. Well, some of the terms you got. Okay, it's pretty good. But you can call it okay, written explanation of the things. So you guys didn't really need to write anything down. Okay. And as I said, it's okay, at the back of each chapter, do you have an exercise? So once you're done with the chapter, what I would just recommend is just go to the exercise, try to answer. It's pretty much the same question, just being asked in different ways. Clear? Okay.
Okay, thank you.
Right. Okay. So if you did that, you should be more than good. Now off the record, and since it's off the record, any questions, guys? Any questions, any concerns, any feedback? Besides, Mike, could you please write some clear? Okay, now if there's something that you can't read, please let me know, okay, guys? I have no problem. It's okay trying to spelling it out for you guys. So. Now our next word is going to be onk. Onko. And we pretty much, okay, yes, mentioned that the other day when we talked. Cancer. Okay, why? Because, okay, we also had another word that meant cancer, which was carcin. Okay. Now, maybe that's okay, just a couple of words for, that's okay, where we use the word onc. Probably is okay, what we call oncology. Okay, which would be as okay, the specialty of diagnosis and treatment of cancers. Okay. And who is going to be doing that? Well, he or she is going to be an oncologist. Yeah, okay. And what we also said the other day, that we had something that we called an onco gene. Right, okay. Which means okay was going to be okay a genetic. We can just okay say mutation that causes cancer. Okay. So here's okay the word gene is related to this. Now, just to, yes, okay, if we just look at, for instance, yes, okay, oncology.
Sorry, is this the different mutation?
Hamida?
Right there it says, does that say genetic?
Mutation.
Okay, all right, sorry.
Mutation.
Okay, thank you.
Is that better there?
Thank you so much.
No problem. Okay. We can say, okay, yeah, this word will actually is okay, B is okay, I guess it's okay, the genetics. Okay, guys, next word. Ophthalm. And of course, okay, if needed, combining O. And the word ophthalm means eye. Asthma.
Yes.
What do you call eye in Arabic?
Ayn.
Ayn. Exactly. Do you speak Punjabi? A little bit? Do you know what eye is called in Punjabi? No? You don't know eye?
Is it Agka?
Okay, maybe or Akia.
Akia, yeah.
Okay. Good. So we can learn some more languages here. Okay. Okay. So eye. So Now, there's also going to be another word that will mean eye. Okay, and that's going to be opt. Okay, always okay. The word opt actually that's okay means seeing, right? Okay, actually it's okay. The word opt means seeing. But as okay, it is still also going to be as okay in some instances. Okay, be referring to the eye. Okay. Now we can say ophthalmologist. Okay. A specialist in eye diseases. Okay. Now, usually it's okay if you go to an ophthalmologist, okay, he or she will check your eyes with the help of an ophthalmoscope. Okay, that's what you see in figure 1.8, section E. Okay. Him or her is okay using that ophthalmoscope. Is going to be, if you recall, is okay, ophthalmoscopy. And that's what you see in figure 1.8 B. Okay. And what they actually is okay, look for in an ophthalmoscope is what you see in figure 1.8C. So that's actually is okay, the image that they get from looking through is okay, that small hole in your ophthalmoscope. Okay, which is all that's also going to be as okay a source of light. And that's actually just okay, the inside of your eye or the back of the inside of your eye. All right, so that would be as okay an ophthalmoscope or scopy, which is done by an ophthalmologist. And why did he or she become an ophthalmologist? Because he or she specialized in ophthalmology. Right? We can also say it's okay, ophthalm. And if we just accompany that with the suffix "ic," that becomes as okay pertaining to the eye when using the word ophthalm. Did that make sense? Now we can also say, okay, we say, okay, we use the word opt. Okay, where I say, okay, the word opt actually is okay, literally means seeing, but it's also as okay going to be related to the eye because okay, that's many as okay what you use to see it, right? Okay, so that's why you can say it's okay, opt ic. Okay, so some people may use as okay the word optic or optics. Okay, And you can say, okay, this is what it looks like, right? Okay. Or this is what the optics. Okay, so, okay. Now, okay. A funny word, no, not funny. It's not going to be fun to experience that. Because it's okay, we may have opt, which is just okay. In this case, it's the I. We may have alg, which is going to be pain. And that's going to be just okay, ear. We just calls it, okay, with mean or mean that this whole term here becomes a condition. Okay. So what some people will say is okay that I got, that's okay. Pain in the eyes or painful eyes is going to be as okay, opt algia. Did you guys get that?
Yes.
Okay. And it's, although it's okay, you guys may not be dealing with medicines, but you can say it's okay. Anything which is going to be it's okay, optic, for instance, drops or something like that, or ointment. That mainly means that okay, as this one here is going to be as okay, it's going to be drops that are used for the eyes. Did you guys get that?
Yeah.
Good. Now, guys, just taking our one letter here is going to become something completely different, which would be ought. Now, is there anybody who knows what the word ought means?
Is it ear?
Exactly. Very good. Ear. So you can see it's okay, for instance, otic or otic pertaining to the ear, right? Okay. We can say ought it is, where this is going to be as okay. Ear. It is. Is going to be infection. Okay. Now, guys, out of yes, okay. All of the cases of yes, okay, otitis. The common type of otitis is going to be as okay, what we can call otitis. Media. Okay. Now, please, guys, yes, okay, here, this media doesn't mean social media. TikTok, Instagram, Snapchat, etc., etc. The word media here actually, yes, okay, is it's okay, middle. So, guys, that actually is okay, something that we call as okay, the middle ear. And when you develop an infection in that, that's going to be called otitis media. Did you guys get that? Now, not necessarily, yes, okay, people with, okay, yes, ear infection or mid-ear infection may not necessarily have fever. But how would you suspect that they have otitis media? And you say, okay, we need to take you to the doctor. And I said, yes, okay, they may not necessarily have a fever. Have anybody ever had an ear infection? Good. How was it?
Trouble.
They're painful.
It's painful, right? Okay, so yes, okay, it hurts. So you're going to have, yes, okay, pain in the ears. So what in the would we call that?
Optalgia? No,
Otalgia, exactly.
otalgia. Yeah.
Right, okay, well, ot is, sorry, ot is just your ear. Well, okay, yes, the alg is, well, okay, yes, pain or painful. And then it's okay, ear just becomes as okay. That this whole word here becomes a condition. But mainly it's okay, we just mean that's okay. We can say it's okay. A condition of pain, or we can say painful ear or ears. Okay. So please, guys, that's okay. It's just a matter of okay, as one letter being added or taken out. And you may go from, yes, okay, in this instance, okay, from the eyes to the ears or from the ears to the eyes. Did you guys get that?
Yes.
Okay. So Shanavis would be the deny copy. Next to words is osti. Oh, where osti means bone. Now, usually, as okay, I talk this when I do, yes, okay, arthritis. Now, I hope you guys remember what arthritis was, okay? Joint, and not the joint that you some people may be smoking. And weakness is okay, inflammation. Okay. So that actually is okay, is a subtype of arthritis, which is going to be called osteoarthritis. Of course, okay, this would be a combined. Okay. So what is osteoarthritis? Now, of course, okay, what you need is okay, you will need a joint. So how do we get a joint? Mainly because that's going to be, we can say, it's okay, where two bones meet. That makes a joint, right? Okay. Now, what these bones here are going to have at the ends where they form joints. And especially as okay, if this joint here is going to be, it's okay, be freely mobile, there's going to be a kind of tissue that we call cartilage. And what mainly happens in is okay, the osteoarthritis here, or a kind of arthritis, which we call osteoarthritis, is that this cartilage here gets damaged. Okay. And what may happen at the end is that, okay, what you have is you're going to end up with, okay, it's 2 raw ends of bones in this joint that's going to be rubbing up against one another every time that joint is moving, or even if it is not moving. Okay, so this is a common type of arthritis that may affect your a common joint is the knee. And why knee? Because it's a weight-bearing joint. Okay, so even as okay, standing up can lead to as okay, excruciating pain for the patient. Okay. So generally, as okay, it is just a type of arthritis, but as okay, we call it osteoarthritis. So what happens in osteoarthritis that cartilage at the ends of the bones is eaten up. Did that make sense? Now, guys,
Yes.
there's another type of arthritis. Some of you may have heard of it. If not, well, okay, yes. Okay, so it's still going to be as okay an arthritis. Okay, and what we actually is okay. So we can still say it's okay. It will still be arthritis, which we mean is okay. We'll say it's okay. It will be as okay. Some sort of inflammation of the joints. Okay, but this type of arthritis we call it a rheumatoid arthritis. rheumatoid, rheumatoid arthritis. Have anybody ever heard of that fellow? Good. Anybody want to say anything about it?
It's where your autoimmune system attacks your healthy cells.
Which cells?
I believe the white, red. There's only 2 options. Red or healthy cells. Well, the healthy cells.
Okay. It's autoimmune. So once you say autoimmune, what cells are going to be related to your immune system?
Your red blood cells.
No, your white blood cells there.
Okay.
Okay.
Thank you.
Okay. Okay. Now, in most instances, okay, how does this thing here get triggered? Have any of you ever been to the doctor with a sore throat? Everybody at some point had suffered a sore throat, right? Okay. Clear. Okay. The doctor may look into your throat and okay, yes, it could be a virus, it could be a bacteria, it could be as okay an array of bacteria. But have you guys wondered why is it that they want to scan you or test you for strep throat, or what we call strep throat? And you get that long swab that's okay rolled up against your throat, which may induce a gag reflex, and you
Maybe for thyroid diseases?
no, not
No?
strep throat, my dear. Have you ever heard the word strep throat?
I have. I've had it.
You had it. Did
Yeah.
so? Did they?
Yeah, they
Okay.
put it.
Now, out of all the okay infections that okay as may happen in the throat, why is it that they want you as okay make sure that it is or isn't strep? Now, strep actually is okay. Is a
Contagious.
I think the
Contagious.
okay. It can be contagious. So can a lot of other things be.
Maybe they want to check on it, because it's your passageway to breathe, and they want to treat it
Okay.
properly.
So what about? Okay, that's fine.
Okay.
Listen. So what happens? You had strep throat, okay? Or anybody has it, okay? Or God forbid. What is that your body will do as a response to that? Develop, okay, some sort of immune response, right? Okay. What is that your immune response will be doing is fighting off that streptococcus. That's the name of the bacteria. Okay. Okay, Streptococcus beta hemolyticus. That's the one that they check for. And why is that? Because the kind of white blood cells that your body produces in response to that streptococcus, that strain of streptococcus, may later on, as like once it had dealt with the strep throat or streptococcus or bacteria, they say, well, okay, I'm really bored. And if you just okay, leave a lot of just okay young teenagers in a town where there's nothing to do because life is so boring, what is it that they will end up doing? Yes, Jennifer.
Link up.
Arm it up.
Have relations? Is that what you're talking about?
Nah, not necessarily. They're going to just okay cause trouble, right? The next thing you know is okay, everybody's mailbox is on fire. Now don't do that. Those of you who still are teenagers, don't go around and okay, set people's mailboxes on fire. But just you guys have a lot of trouble, right? So that's pretty much okay as what those white blood cells may do. They was okay, there's no streptococcus to fight. So what the blue do we do? They may actually just okay go and start target normal tissues. And that's why we call it an autoimmune condition, right? So one of the tissues or one of the areas that can be targeted is going to be the joints. So that kind of arthritis is what you call rheumatoid arthritis. Okay. And it can come back and again and again and again and again. And you may see as okay some severe cases of rheumatoid arthritis where the hand may is okay, it looks like a claw. They can't straighten the fingers out and they got like a big swellings pretty much okay around the joint areas. I used to work at a pharmacy when I first got here to the States. And one of the guys that used to come in to get his prescriptions filled up had so bad rheumatoid arthritis that okay, yes, it was hard for him to yes, okay, even get out his insurance card from his wallet. So that's okay, getting the wallet out of his pocket, forget about that. Be able to just okay, grab onto just okay, the insurance card or credit card from that wallet and take it out was you know, it's okay, a worst nightmare. So it can be as okay, very, 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 very as okay, deformative, as okay, changes in the joints where it's okay, okay, and it usually as okay affects arms, wrists, elbows, knees, toes. So even as okay, that distribution as okay can explain it. So that was rheumatoid arthritis. That's another type of arthritis. Then there's a fellow called, which is still is okay. There's another form of arthritis, although it's okay. In this case, it's okay. You may not see the word arthritis, okay, but it's still a type of arthritis, and that's called gout. Anybody ever heard of gout? Nope. Okay. Now, gout is pretty much okay as a word that has been around for this condition for centuries and centuries. Okay, but as I said, it's okay. It is a form of arthritis, and that's why it's okay. Some people may also call it. So this is arthritis. Uric acid arthritis. Because it's pretty much okay as this substance here. Uric acid that causes the arthritis. So there's going to be a substance that your body produces, which is called uric acid. Now, if you look at the word uric acid, what does it smell like?
Urine.
Urine. So it's mainly as okay, something that you should have been peeing out. Did that make sense? Okay. So it's pretty much okay as a waste product that should have been peed out. Now the question comes, where in the does this uric acid come from? And that's why they also used to call this type of arthritis here is okay, the rich man's arthritis. It was a prestigious disease to have. No, it's super painful. Mainly as okay because this uric acid came from breakdown of proteins, which you mainly as okay find in red meat, kidney beans, and red wine. And back in the days, I'm not talking of 2024, but it's okay in nowadays, but it's okay. Back in the days, it was only going to be the rich people who were able to afford red meat and red wine. So it's okay, consuming a lot of it's okay, substance that's okay, which ultimately is okay when chemically broke down, that's okay, will produce uric acid. And that uric acid gets pretty much okay, you can say deposited in the joints, and that causes the joints to get inflamed and become painful. Now, guys, so that's what they call gout, or yes, okay, uric acid arthritis. Now, guys, out of all the joints in the body, out of all the joints in the body, 90% of the cases who suffers from gout, the first joint to be affected is that of the big toe in 90% of the cases. And it's $1 million question. Out of all the joints, why that of the big toe? Why not that of the thumb or the hip or elbow? Why the big toe?
Maybe the nerves that are connected.
No, Michelle, because it has nothing to do with the nerves. It's the uric acid that gets deposited, but it's okay out of all the joints. If it's able to just okay infiltrate or it's okay get deposited into the joint of the big toe, it should also be able to just okay affect the joint of your thumb or wrist or elbow or shoulder. So 90% of the cases, okay, who starts as okay develop gout, the first joint to be affected is that of the big toe. Well, it's straightforward, just okay diagnose. They will say, okay, well, let's just check, okay, as the uric acid level in the blood. And if that is high, okay, then you can get some drugs, or the person can get drugs to take. But it's okay. They may say, well, okay, you got to, it's okay, reduce your consumption of the goodies. And what were the goodies? Red wine. Okay, red meat. And it's okay, kidney beans. Or we can say it's okay, that's pretty much okay as substance that people consume which are rich in that protein that break down to become uric acid. Okay, so the poor peasants, that's okay. They were not able to eat red meat. Maybe they get okay as a little piece on Christmas or Easter or something like that, but otherwise, no. Okay. So, but that's why I say it's okay. It used to be as okay a prestigious disease. You're privileged if you had gout. Well, it's okay. It's super painful. So, okay. So, okay. Good. I think we should get out of the arthritis and get back to the osteo. So we have oste. Now we may have osteoma. Okay. And guys, now okay, yes. Yes, okay, the oste, that was bone. And the oma was, yes, okay, tumor. In this case, it's okay, we mean tumor. Now our question just is that going to be cancer or non-cancerous? And guys, when we say osteoma, that's going to be a non-cancerous tumor of the bone. Did you guys get that? Okay. So you can then say, also, what we will call is okay, cancerous tumor of the bone. Now that is going to be as okay, be osteo. Where oste is okay here, as okay was your bone. In this case, it's okay, the O is going to be as okay a combining vowel. Okay. Now somebody says, okay, cancer will be carcinoma. But no, it's not going to be carcinoma. It's going to be something that we call sarcoma. And why do we use the word sarcoma? or as okay, a cancerous tumor of the bone. Pretty much, guys, because okay, what the bone is going to be. Now, bone is going to be as okay, an example of what we call connective tissue. So whenever we talk about as okay, a cancer of a structure that involves connective tissue, that cancer is not going to be a carcinoma, but we use the word sarcoma. Did you guys get that? Okay, guys, so please, please, please. Osteoma is a non-cancerous tumor of bone, whereas osteosarcoma is going to be a cancerous tumor of the bone. Okay, why did we use sarcoma and not carcinoma for the cancerous? Mainly because, okay, we may just, okay, use the word sarcoma. Either is okay if we talk about connective tissues or muscles. Okay, so this word sarc or sarcoma is okay, is going to be brought up in just a little bit. Okay, we can just take one last word with the word as okay with the term oste. We can say it's okay, oste is bone. O, well, okay, that's all combined vowel. And we can say site, which is cell. So what is going to be an osteocyte? That's just going to be a, what we in common terms can call a bone cell. So in plain English, yes, okay, we'll call it a bone cell. Technically, yes, okay, it will be referred to as an osteocyte. We can also say oste, osteus. Which means, okay, in this case, it okay, will be as okay, pertaining to bone.
Is it osteic or osseous?
No, it's osteos.
Oh, osteos.
Yeah. Oste for bone, O combined vowel. And then you can guess, okay, go US. So osteus. Okay, so this is US. Just like in us. Okay. So it becomes osteus. Okay. Usually it's okay when we use the word osteus, it's going to be as okay we're going to say osteous tissue. Which means okay, it will just be as okay a word that will mean bone tissue. Did you guys get that? Okay. So it's going to be osteus pertaining to bone. Okay. Any question, ladies and gentlemen? Nope.
No, not at all.
Not at all. Okay. Anybody? Then we can say it's okay. We just slowly, it's okay, following the path. Through the chapter. Now, I said earlier, path means disease. Clear? Now, guys, when you guys go for your scanning module, so start talking scanning, you may come across the word pathology. And again, it's okay, you can say it's okay, the word pathology is okay, may mean one thing. And the term A is okay, may mean something slightly different from that. But it's okay. In this case, it's okay, path is disease. The O is just going to be as okay, you were combining vowel to connect the path with the logy. Which just means okay, the study of. So if you look at the words pathology as okay, what it may mean or what it may tend or look like to mean is the study of disease. Clear? Okay. But what in the blue word is it that pathology is? It's the branch of medicine in which we study the development of disease. So earlier, guys, when I talked about, yes, okay, strep throat leading to such thing as, okay, as rheumatoid arthritis. That was the pathology of rheumatoid arthritis. But you can mainly say, okay, all the changes that happens in the body either as okay in the development of a disease or as okay as a process of the disease itself, where the disease just progresses. All those changes, when you study those, that's going to be coming under the study of pathology. Did you guys get that? So pretty much, okay, the science where we study is okay, how is it that different diseases develops? That's pathology. How is it that smoking like a chimney may lead to, yes, okay, lung cancer? Okay, what is it? Okay, we may not know the exact substance in, yes, okay, tobacco smoke that may cause lung cancer. But it's okay, the overall is okay, changes that, okay, it starts as, okay, occurring in the lung and so on, so on, so on. All those, that's okay, that's, you can say, it's okay, how is that lung cancer develops? So all that comes under pathology. So the science in which we study is okay, how diseases develops is called pathology. I just summarize it down by saying, okay, smoking leads to cancer, but okay, so there's a lot of moral details into that, okay? Okay, so, but studying those as, okay, that would be pathology. Now, usually, guys, a patient may see as, okay, all the staff of doctors and nurses and whatsoever who is okay take care of him or her. Probably one person that he or she may not see is the pathologist. So where in the hell is the pathologist in all this? Those are usually the people who sit in the labs and checks on the blood specimen, tissue specimens, etc., etc., etc. Okay. If anybody have ever, yes, okay, had experience of, okay, as working in a lab, then most likely, yes, okay, your chief of that lab would be a pathologist. Okay. But yes, okay, you have to be a medical doctor to become a pathologist. You just specialize in pathology. So that's pretty much okay what they deal with. So pretty much okay based on yes, okay the specimen, the test that they do, the results that they get from that, they generate a report. All those as okay COVID tests that might have to be sent off to a laboratory. That would be a pathologist who would be sitting there as okay, yes. Testing. Or you can say it's okay, it may even as okay play a role in okay the developing a test or COVID. Does that make any sense? But okay, what are the possible changes that this fellow here could lead to, right? Okay. So all that is okay comes under pathology. Now, guys, how much do you guys know by now? Or do you feel that you are well equipped with knowledge so far? Good.
I believe so.
Okay. We may start getting second thoughts. Because, guys, you may come across a term, not just you, anybody. Oops. This needs to be written. So this is actually, we can say, okay, we can say, actually, where are we? Good. Okay. Okay, the word pathy or path. This is disease. The Y here is okay, that's okay, becomes that's okay, because that's okay, a condition. Or what kind of condition? EDO. And what does EDO mean? Don't know. So from idiopathy comes
It's a personal.
idiopathic. Now, what will be idiopathic? We don't know the pathology. Or what was it that the word idio mean?
Personal or private, own. I don't know.
Idio, I-D-I-O.
No.
Don't know. So yes, okay, all that pathology that we talked about earlier, when we didn't know it, rheumatoid arthritis was idiopathic. We see, yes, okay, we see something, yes, okay, going on with the joints. But how it happens, we don't know. What triggers it, we don't know. What causes it, we don't know. We don't know anything. Clear? So at that point, it's okay, it was idiopathic.
So,
Somebody, okay, may just be scratching their head and say, all right, your body is just acting weird. Okay.
so would it be a condition of an unknown disease then?
Why? Because it's okay, of unknown origin, or it's okay, we don't really know what the is happening, right?
Yeah, thank you.
Okay. Good. But if you just look closer and now guys, please do not be offended. But if you just look closer at the word idio, what would this be? Who would you call an idiot?
Someone who doesn't know
Person.
anything. Sorry.
Okay, go ahead. Yes, Brianna.
A person who doesn't know anything. Or is dense.
Right. Okay. Where did that come from? From idio, where we are the idiots, right? Because we didn't know. Yes, guys, that happens when you end up as okay, learning yes, okay, English as okay as a third or fourth or fifth language. You may look at words at different ways. Yeah. So yes, okay. If some bad thing is idiopathic, we can say, well, okay, right now we really don't have an explanation for it. Okay. What causes what's going on, how it works, how it progresses, what triggers it, so on, so on, so. Like the first cases of, for instance, AIDS, they didn't know what was going on, right? Now, some of you is okay. A whole bunch of you probably may not even have been born at that time when the first cases of AIDS surfaced. You may just have heard of it or read about it in the books or so. So in the beginning, yes, okay, it was an idiopathic phenomenon. We didn't really know what caused it, what to expect, what's the prognosis and all those. Okay, forget about diagnosis. Okay. It later on come on that okay, there's something going on that smashes the immune system and all that. And we can always at some later instance talk about okay, the conspiracy theories, because I don't believe that it came from a monkey. Okay, so have you heard that one? That it came from a monkey?
Yes.
Okay. I guess okay, okay. That's fine.
Government conspiracies.
Huh?
The government conspiracies, right? Is that what you're saying?
But okay, I'm not going to say the government, but probably it's okay. Something we probably not being told the real truth. That's all I can say. So I've seen documentaries. Yes, okay, by accident, where it actually is okay was documented that there's and I found that more convincing um, than okay saying okay it's because a couple of crazy dudes ends up okay as finding having sex with a specific species of monkey is or even that's okay not just direct but okay you guys know since we are at it okay uh, when they trace it back where did they find the origin of it of AIDS? Where's that traced back to? Where? Now when? When the
Isn't it
population
Africa?
exactly Central Western Africa. Now, what was the theory here? Or the theory that has been fed not just by your government here. Yes, okay, we even have it at okay, yes, in med school. Yes, okay, on the International Day of AIDS. Because what they thought, okay, yes, okay, this okay, they find this virus, okay, it was also found in okay in a specific species of a monkey. Okay. So the theory actually was how did it get from monkey to people? That what they thought of okay of that monkey is okay in those parts that it was sexually very potent. So those tribes in that area is okay had a ritual of okay as rubbing the blood of the genitals. That the man actually is okay will rub the blood on the genitals so that he could be good in bed. Let me just be honest. And that's how they say it's okay that it went from monkey to human. Okay. If that's the case, I'll say, okay, that it should just have been limited to, yes, okay, that tribe or group of population. So that's okay. A documentary that I think I saw on Discovery or National, that's okay, National Geographic or History or something like that. Was okay, these countries where okay, as it stems back to, yes, okay, used to be colonies of okay, the French or Spain 200-300 years ago. And what they were trying to do back then was just okay, develop vaccines. Just like okay, they were trying to develop vaccines for COVID recently, right? And who did they use as guinea pigs?
Animals.
No, the people. And actually, that's okay. What they showed in that documentary was that, okay, as the notes or the documentation was that, okay, these people who is okay were guinea pigs for the development of the vaccine started showing us, okay, these weird symptoms where we as okay compared to as okay what we see in HIV or AIDS patients was pretty similar. So we say it's okay, high vision is always 20/20, right? So I find that more appealing than say, well, okay, it's because somebody think that okay, yes, the blood of a little monkey is okay could be a good equivalent to Viagra, whatever you call it. So yep. So 102, that's okay to the conspiracy theorists, as we may call them, because they come up with an explanation other than what has been explained otherwise. Okay, that was a sad story, but okay. So that was path, but that's okay. Idiopathic, when we don't know the pathology, right? Okay, when we don't know, it's okay what caused it, how it triggered, how it develops, and we may not even know it's okay what to expect in the future. Right now we are okay, it's completely blank. Okay, clear? Well, yes, okay, even if you look at it, yes, okay, that's where the word, or from idio, yes, okay, that's where the word idiot comes. Good. Psych. And we may be straightforward as okay, just combine that with okay as a combining vowel called O. So it becomes psycho. Now psycho is made as okay, just a slang because the actual word is going to as okay for somebody who is psycho is going to be
Insane or crazy.
psychotic.
My bad.
That is okay, this just for me is okay pertaining to psycho. Now guys, what would the word psych mean?
Mind.
It means mind. Let me just put it this way. And somebody will say, okay, but isn't that something to do with the brain? Right. Okay. And that's why somebody said, okay, as neurologists, just okay, they deal with schizophrenia, psychosis, and all those. Okay. That's okay. What the neurologist may is okay, more deal with, okay, as you can say, it's okay, more physical, or yes, okay, maybe a little bit chemicals. Okay. So the brain and mind. Brain is what you see, you don't see the mind. Just like your body and your spirit. Clear? Okay. So the mind is to the brain, what the spirit is to the body. Did that make sense? Little bit is okay, spiritual. Okay, you can see the body, but you don't see the spirit. at least not with your naked eyes. You can see the brain, but you will not be able to see the mind. Clear? Okay. Good. And again, guys, now it's okay when we say it's okay, psych, that becomes mind. And we say psychotic, that's pretty much okay as when somebody is nuts or insane. Now, guys, the word insane, nowadays it's a curse word, right? Would any of you like to be called insane? So of course, that's okay, it's a curse word, right? But that's okay. What nowadays is a curse word, yes, okay, used to be the normal term back in the days. So that's okay. One of the yes, okay, psychiatric units that I worked at, well, okay, they were running out of space in the departments. Okay. I guess okay, more and more patients were becoming mentally ill. But they, yes, okay, were running out of space, so they didn't have enough room or beds. Oh, so it's okay for the patients. So what they had at that place was okay as this building. Well, nothing wrong with the building, but what they mean is okay, just has used it as okay as a tossing store. Broken chairs, broken furniture, shelves, maybe it's okay, even books and all that, okay, that they didn't need anymore. Just toss it here. Okay, so you can say okay, a big junkyard of okay as tools and things that okay weren't used anymore. So they say, okay, we have this building. There's nothing wrong with the building. It's just, okay, what's inside the building is of no use. So what they did was, okay, they went on, okay, as an operation cleanup. And what did they find? The front board for the department dated, okay, as 20, 30, 50 years ago. Which didn't say as, okay, the psychiatric department. It said the Department of Insane. So yes, okay. Now it's okay, it's more, it's okay, decent, it's okay, psychiatric. So it's okay, a person who deals with psychotic patients, schizophrenics, depression, eating disorders, OCD, things like that, PTSD and all those things, that's okay. That's going to, he or she is going to be a psychiatrist. Okay, now please keep in mind, guys, okay, psychiatrists, yes, okay, they are primarily medical doctors. So they still have to go, yes, okay, through med school, but then afterwards, yes, okay, so okay, I want to deal with psychiatry, things like this. Okay, oh, yes, okay, just some of the conditions that I just made is okay, mentioned earlier. Okay, so it's okay, he or she is okay, will specialize within psychiatry and become a psychiatrist. Okay, so they got to be as okay medical doctors. You may see that okay, yes, there's something that is called psychologist. Now, guys, these are not MDs. These are not medical doctors. Okay, but what is it that you do if you go to see a psychologist?
Talk about your problems.
Pardon me?
Is it? I don't. That's a therapist, a psychologist. Would it be the same? Like talk about your problems
Yeah, therapist is just going to say, okay,
and get like medicine for your problem.
To some extent, no, the medicine, my dear, that would be the doctor.
Okay.
So can't prescribe medicine.
Okay. Right. So they can mean okay, just suggest, okay, I think this person has this and this and this and this psychological disorder, depressed, schizophrenic, whatsoever. Okay. Or so and so. Or it's okay. May end up as okay as a serial killer if you don't take care of it. There now. Okay. But it's okay, they will work in it's okay, close really, it's okay in it's okay to have a close working relationship with the psychiatrist. So a lot of okay psychiatric departments will have their own psychologists. Okay. By psychologists, guys, okay, they may be called doctor, but that's just because they did a PhD in psychology. Okay. So people who did PhD in anything is okay will become doctor. You can do PhD in music and you become a psychiatrist. You will be entitled to call yourself doctor. Okay, but just because you did a PhD in music doesn't entitle you to prescribe medications. Okay. Okay. So that's okay. Every psychiatric department is okay. Will have one or as okay a smaller or bigger group of psychologists. Okay. But when it comes down to it's okay to the final diagnosis, it will still be up to the psychiatrist. Prescribe medications, yes, okay. Okay. Now you say psychotherapy. In many cases, okay, medicine may not be the way. Okay. Drugs may not be the way. So that's okay. What do? They suggest, okay, engage this person in such and such activities just to take his mind off his psychological problems and so on. So, okay. One of the departments that I worked at, one of our he actually was a professor in psychiatry, but what he mainly has subspecialized within was OCD. So a lot of his patients just they didn't get any medication, psychotherapy. Okay, so when you say psychotherapy, that's okay. That just brings us to another word, and that's why I say, guys, speak. Say something because what you say is okay. Me, bring me to yes, okay. Something else that you say is okay. Psycho. It's not going to it's okay. Still be yes, okay related to your mind, but then we yes, okay go therapy. Okay, well, okay, as the Y main is okay indicates that okay, yes, some sort of process, but it's okay what the word therapy actually will mean. Treatment. Okay, so in most instances, okay, when you say psychotherapy, well, it's not necessarily going to be treatment with drugs, but it's okay other approaches. Okay. Now, one of the department, okay, sorry. Where I worked, yes, okay, we didn't treat a lot of this chronic cases of executive drugs because it had proved not to work for them. Why? Okay, maybe it's due to their mental disorder that they just say, they just become stubborn. I'm not going to take the medication. It makes me feel uncomfortable. I feel like a zombie. I'm this, I'm that, so and so. It just makes me worse, so and so. So we actually had this hospital where we said, let's see if we can do some other things. So some sort of psychotherapy. So in that place we had a lot of different subunits. This is for the schizophrenics. This is for the psychotics, depressed people with eating disorders and so and so. So the unit that I was as affiliated was mainly for people with drug abuse. Yes, where they use drugs or ended up in as a severe drug abuse to try to deal with their mental issues. But as other drugs didn't work out for them, so we just treated them in alternative ways. Yes, that's minimize their medicine consumption as well. Okay, so. But as I said, yes, mind is to the brain, like spirit or soul is to your body. Now, some people, yes, say what happens when you die? The soul departs. Now, some people may not believe in that. But strange enough, I think that, as somebody has been able to just, record that something leaves the body as the person died. And we're able to just, record that. So, bias, in a physical person, yes, you don't see the soul or the spirit. Like in the brain, yes, you don't see the mind. It's there, but it's just we don't see it. Any questions? Nope. Okay. REM. Now, guys, as I said earlier, REM is just a word that meant kidney. Now we can say it's REM all. Okay, and it's not going to be REM all, it's going to be renal. Okay. That is just always be pertaining to the kidney. Okay. We can say it's renal, for instance, failure. So what we in common terms will just call kidney failure. Can also be called renal failure. Right. What else can we see? REM. O. Lithiasis. This means well, you said cis was yes. brushes and lid was stone. So developing of kidney stones is what we call it. Renolitis, sorry. No, that's actually okay. Something that we call renopathy. Okay, now again, yes, okay, this is just going to be, yes, again, yes, okay, an umbrella term of, okay, yes, kidney-related diseases. Okay, and as I said earlier, okay, as I said earlier, for neuropathy, this one here also is okay, a complication of diabetes. Okay, which means to me that, okay, yes, if that diabetes isn't well controlled, it may lead to, yes, okay, problems with the kidneys as well. Okay, and not just that, but it's okay, other diseases as well also can come underneath the umbrella term called renopathy. Did you guys get that? Okay. Any questions? Nubby mubby. Hey. Rhine or Rhine-O. O is okay, the O is still is okay, just our combining vowel. But that's only if we need to put the O in the Rhine, which is nose. Okay. Now, please, guys, okay. There's another also going to be okay another term that may mean nose or refer to nose, and that's going to be nas. Okay, you may have heard the term nasal. Here's okay. The L is just a suffix that means pertaining to. So that's okay. Pertaining to the nose when used in the word. Nas is going to be nasal. We use L. There's okay if we go with Rhine. It's going to be Rhine. Ick. Which this means okay, just will mean the same pertaining to, and Rhine is your nose. Did you guys get that? Now we can say it's okay. Rhine. Now there's a term that we call Rhine. Itis. Now it's pretty rare for the nose to get infected. So mainly it's okay, just inflamed. Okay, so inflammation of the nose. Okay, now when we say rhinitis, is mainly it's okay going to be inflammation of just okay the inside of your nose, so your nasal passages and things like that. Okay, dear. Now here comes another okay. Let's talk of okay as another. So we can say rhino or rhine. All combined vowel. And here we will say rhea. So rhinorrhea. Okay, so what is rhine? Nose. Now go look over the tissue. Okay, nose, O combined and vowel, and what does rhea mean? Runny or running. So how would we present rhinorrhea in a picture? And nose that is running. Pew, beep, beep. Okay, a runny nose. Clear, okay. Why would somebody have a runny nose or a running nose? Because of rhinitis. Clear? Okay. Or, yes, okay. Rhinorrhea can also be, yes, okay, a complication of, yes, okay, a post-op complication of pituitary tumor operations because they go through the nose up in the skull, and from there it's okay. So that's something that we would see as okay when I worked at a neurosurgical unit. Actually, that's okay. So, so one of the things that we had to watch out for is make sure that the patient doesn't blow his nose for XYZ amount of days, because it may cause that he will start getting rhinorrhea, and it may going to be it's okay fluid from the we can talk about that. That actually is okay, will start leak through the nose. So now, guys, let's just talk of a funny term. Have any of you guys seen the word, the program called Botched?
Yes.
Yes, where they
Okay.
fix rhinoplasty or whatever.
Rhinoplasty.
Mhm.
What's the name of that doctor? What's his name?
Dr. Nassau.
Dr.
Yeah,
Hello.
rhinoplasty. Okay. And again, it's okay, guys. You can say it's okay. Now here it's okay. The Y just means that okay, this is a process or procedure of the rhine nose. Okay. Whereas okay, we take the word rhinoplasty and say it's okay, make it plastic. This ick here just becomes pertaining to plasty or plast. So the question is, why do we call it plasty or why do we call it plastic? Now, what is it those guys on botched are?
Surgeons, plastic.
Okay. Plastic surgeons.
Yeah.
Right. Okay. Now, why in the hell would we call a surgeon a plastic surgeon?
Because I don't know.
Yes. We shall say something. You were about to say something, but then you just chose not to. It's okay. Why do you think that a plastic surgeon we call a plastic surgeon?
Because they're reconstructing you in a way that you want to look. So if they're taking the
So
nose,
what does that have to do with plastic?
Barbie? Is it what they're
You said a neurosurgeon, he was called a neurosurgeon because he was operating on your nervous tissue, right? So why would a plastic surgeon be called a plastic surgeon?
It's because of what he's putting into your body?
Huh?
What he's putting into your body?
Putting into your body. Okay, what do they put into the body?
They could put in implants.
Okay.
Yeah. Yes.
So why not just call them implanting surgeons?
Maybe because the way they mold and shape your body.
Okay. Just like you can mold and shape plastic?
Yeah, I don't know.
Okay. Anybody else want to contribute to the discussion?
You know how like for rhinoplasty, is it like because of the plasty in the word or no? I don't know.
That's okay.
Is the material they use like in some of the objects or silicone have plastic in it?
Okay. So why did they use anything but silicone? What they have you call something else?
Is it like where they replace like cartilage, like things with cartilage, like
Okay, guys, it has nothing to do with plastic. Okay. Susan, what did you say earlier, dear?
reconstructing.
Reconstruct. Or to be more accurate, guys, what the word plast means. Plast, P-L-S-A, P-L-A-S-T.
Is it like flex?
Is repair or correction. So it had nothing to do with, okay, plastic implants. It just becomes just, okay, pertaining to plast, which is repair or reconstruction. Okay, I know, yes, okay, guys, because what's the other guy's name in Botched? Not the nose guy.
DeBrio.
Exactly. What is he fixated on?
I thought he did a lot of noses. No,
No, that's
the other one.
that's the other guy.
He fixes like anything that has been botched, meaning like ruined by other surgeons, like the body parts, like the
But one of the main things that you may see that he
boobs.
operate on.
Boobs.
Boobs. Here you go. Right. Okay. Okay. Is that an official decent word?
No.
No. Okay. That's fine. Okay. Well, yes. Okay. Okay. So yes, okay, pretty much okay. When you talk, you can say, okay, that's some sort of okay, that's plastic, but it has nothing to do with the material plastic. This plastic or plast mainly is okay, where just become plastic because pertaining to plast, which is we can either say repair or reconstruction.
I was
that's
thinking,
okay. UAS, okay, corrective. Did that make sense? Okay, guys? And okay, guys, now rhinoplasty, yes, okay, there's that reconstruction or repair. Oh, yes, okay, may even say yes, okay, correction or corrective surgery on the nose. Okay, maybe for once or twice, correction works. After that, it just get botched. And botched rhinoplasty is probably something that we see or could see when looking at Michael Jackson. Okay. How many rhinoplasties did he have done? Too many. And he went from being as okay, a regular as okay, nice looking guy to as okay, something that ends up looking like a ghost. So yeah, that was unfortunate. Okay. So yes, okay, Rhine, nose. Another word for nose is naze. Okay. Okay. So and now you know that plasty isn't, or plastic isn't because of plastic implants, but actually it's okay pertaining to reconstruction or correction or repair. Okay. Or plast, which would be that. Anything else? Good. Now, do you guys know, yes, okay, what was the primary reason for, yes, okay, introducing something like breast implants in the first place?
Maybe when somebody had like breast cancer, wait for them to still have an implant, I guess, like something there.
To, yes, very good, my dear. Okay, to retain the feminine figure, right? Clear? Okay. And no, not that just that, okay, but okay, as what some clinics even may do. I don't know about here in States, but we had that in Denmark where they actually is okay, had tattoo artists. And you say, what the is a tattoo artist going to be doing?
They tattoo like the nipple part to kind of make it
Tattoo
look
the nipple so it
or like
looks real.
real, I guess. Yeah.
Okay. So tattoo something that looks like the nipple. Here you go. So oh yes, okay. They can also yes, okay, go wrong. And we've seen that in what's her name? Who had to have her implants removed.
I feel like a lot of women get them removed after a while.
Okay, but there's one celebrity who got it removed.
Angelina Jolie.
I don't think Pamela Anderson. Have everybody ever heard of her?
Yeah, is that the one from the Beach Girl? What's it called?
I don't know what she's from, but anyways. Okay. Okay, guys, let's go to the next chart. And that's going to be Sark. And O. Now, guys, what the word sarc actually means is flesh. Okay. Now, usually that's okay when we talk sarc. It may be as okay referred to muscles. Now, let me just ask, is there anybody who is vegetarian or vegan? Ah, okay, good.
I'm pescatarian. I'm not vegan or vegetarian.
You're vegetarian, okay.
Pescatarian.
So, okay, good. So if you feel offended, well, okay, sorry, dear.
No, you're fine.
Okay, good. So when you eat the flesh or meat of an animal, what is it that you're eating?
The fat.
The muscle.
You're eating the muscle. Did that make sense? So you say, okay, meat or flesh, that is actually it's okay going to be the muscle. Okay, so in that way, you can put it that way. Okay, now, although it's okay, we're not going to go into the details of the muscular system, but there's actually going to be something that we will call a sarcomere. Okay. Now, sarcomere is mainly as okay going to be as okay just the basic contractile unit of your muscle. But it's okay, we just look here. It's from the muscle or flesh. Now, guys, you may have a word that's going to be myo. Now, this word myo here means muscle. Okay. Now it's actually going to okay from myo. Whereas okay, what we also did was we can say oma. The oma is okay just would mean tumor. Okay, so in this case, it's okay. You may say, okay, they took off one O. Okay, so it means okay, okay. Otherwise, it would have become myoma, or actually, it would have been pronounced as myoma, because double O actually is okay gives you more of a U-like sound. Okay, so here is okay. The main is okay. Just took off one O. Okay, so myoma is going to be as okay a tumor of the muscle. Now the question is still unanswered. Is this a malignant or a cancerous tumor? Or is that going to be a benign or a non-cancerous tumor when we call it myoma? This is going to be a non-cancerous tumor of the muscle. Did you guys get that?
Just had a question. What was the word in sarcomere?
Sarcomere?
Yeah, what does mere mean in that word?
But not it not doesn't really have much of a meaning to it. But what this whole thing here is going to be is okay. We can say the basic contractile unit of a muscle.
Okay.
Okay, now we talk more about this fellow here. It's okay when we get to the muscular system. Clear?
Yes, thanks.
Okay. So myoma, guys, that's going to be as okay, a non-cancerous tumor of your muscle. So the question now is going to be is okay, what we will call what's going to be is okay, the cancerous tumor of muscle. And that's going to be as okay, we will still be using the word my. Actually, it's okay, myo, which in this case is okay, still will mean muscle. Okay, it will still end with the word oma, which actually means is okay, just mean that okay, as this is a tumor. But the term that we as okay will use here to make it a cancerous tumor, since we are using muscle, is going to be sarc. So myosarcoma is a cancerous tumor of the muscle. Did you guys get that? Okay, so for the muscle, yes, okay, we use sarcoma. The sarcoma, that's okay, just becomes the cancerous tumor when we talk of muscles. Okay, so a cancer of the muscle is not known as, you will not see this word, myocarcinoma. Although you can still say, well, okay, yes, okay, that would still have been muscle. Oma was okay, still had been tumor, and okay, as the carcin just makes it cancerous. Did you guys get that? So actually, it's okay. We can say okay, sarcoma will be as okay what we use for cancerous tumors of muscles. And okay, something that we will talk about at a later instance, which is going to be as okay, the connective tissues. I gave you guys an example earlier of a connective tissue. Boom. That said, osteoma was a non-cancerous tumor of the bone. Whereas when we go osteosarcoma is a cancerous tumor of the bone. And again, yes, okay, why did we use sarcoma here rather than carcinoma? Because bone was a connective tissue. Did you guys get that? So sarcoma will be the word used for tumors or malignant or cancerous tumors of muscles and connective tissues.
Just to clarify, carcinomas are cancerous glands.
Cancers.
Okay.
Okay. Now that usually that's okay, will develop in glands and other tissues. Okay. But when we talk about yes, okay, malignant tumors in muscles, you don't use the word carcin or carcinoma. And when we talk about malignant tumors in connective tissues, you don't use carcinoma. There will be sarcoma. Since we are now, that's fine. Let's just take it. Because okay, what can be other kinds of okay, yes, connective tissues? Okay, so we can say it's okay. Let's say it's okay. Non-cancerous tumor and cancerous tumor. So yes, okay, our first connective tissue can be bone. Now, what was the word for bone? Oste. A for S, okay, needed to yes, okay, combined with a combining vowel O. Now, since it is a connective tissue, but okay, we can say, okay, the non-malignant tumor or the non-cancerous tumor or the benign tumor of a bone is going to be as okay, plain osteoma. Osteobone, oma, tumor, but in this case here, non-cancerous. What did we call it when we yes, okay, when there was a cancerous tumor? It was going to be oste, which is bone. Here, O as a combining vowel. But since bone is a connective tissue, we use the word sarcoma. So here it's okay, going to be reverse sarcoma that makes it a malignant tumor. Another connective tissue, guys, is cartilage.